Hello, everyone. We are Team 5, and what you will see is a role play presentation applying an ethical decision making framework, resolving the ethical dilemmas concerning privacy and confidentiality. Let me first introduce my group mates and their characters in the case scenario. Fedelin Brilla as Miss Smith, the nurse manager. Roshin Samuel as Dr. Warner, patient Carl's primary doctor. Nasib Kaur as Mrs. Petty, patient's wife. Catherine Joy Chavez as Joy Cruz, the ethical consultant. And Mary Rose Mariano as Jane, the primary nurse.
The members of the ethics committee receive a report regarding the plan of treatment of Mr. C and the ethical dilemma faced by the staff and patient's family. The patient's wife requested the healthcare team not to disclose to the patient his actual condition and the plan of treatment because of her fear of possible negative consequences on her husband's behavior. This situation placed the healthcare team in an ethical dilemma and violated the law. According to the College of Nurses of Ontario, the non-disclosure violates the patient's right to autonomy, as long as he is capable of making relevant decisions for himself, unless otherwise he is cognitively impaired. Upon knowing his diagnosis, he could practice his right to control his personal health information on the collection, use, and disclosure. The report specifically addresses issues related to privacy and confidentiality and informed consent. Also, issues related to ethical principles such as autonomy, beneficence, veracity, and fidelity.
Monday morning, while Nurse Jane was about to give morning medications to her patient, she saw Mrs. Betty, wife of patient Carl, and Dr. Warner in the hallway, and overheard them discussing the condition of patient Carl.
Hello, Mr. Carl, Mr. Betty. How are we feeling now, Mr. Carl?
Hello, doctor. I'm good. Mr. Call is not feeling very fine, so can you check him?
I know it's hard, but I want to tell you that your husband is diagnosed with liver cancer.
Oh, Dr. Carl suffered, Dr. Warner, he suffered from a post-traumatic stress disorder. And when he was as a veteran in a war, I know that he easily gets affected by the negative emotions. I highly insist to you and your healthcare team to not to tell him about his liver cancer. If you can, I hope so you will understand.
Mrs. Betty, surgery is not advisable for your husband due to the tumor's complicated location, and he's too old for the surgical procedure too.
I'm really very afraid of the negative outcomes. He's too old to suffer. I just want to enjoy his presence in my family in the remaining months or years of his life. Many times I have told you about that, and I'm hoping that you agree on this matter.
Mrs. Petty, I understand you have been begging not to disclose your husband's actual condition because of his attitude to become hostile, right? And he'll be verbally abusive, and when he is intoxicated with alcohol, he tend to be lonely and depressed too. As a doctor for a long time, I also don't want him to suffer. I think yes, this is for his benefit. I understand. I agree with your request.
Thank you.
No problem.
On the physician and patient's wife agreement of non-disclosure, this violates the Personal Health Information Act involving the Privacy and Confidentiality, Substitute Decision Maker, Healthcare Consent Act. In addition, it invades the professional standard of accountability and therapeutic nurse-client relationship. Truth is another element vital to autonomy. This conflict between the patient's right to know against disclosure is one of the most difficult problems in the patient-physician relationship as well. According to the Personal Health Information Protection Act, it is the right of the person to control his personal health information, like how to use and disclose, and with whom to disclose. Furthermore, the Healthcare Consent Act, which has to do with the capacity to consent to a treatment plan, was also involved in this report. It explains that a patient has the right to consent to or refuse the treatment and make decisions if he has the ability to understand the consequences and the recommendation of the physician. However, if he is unable to give consent, then the process of substitute decision maker would be needed to make the decisions about him.
After hearing the conversation of Dr. Warren and Mrs. Petty concerning the condition of patient Carl, Nurse Jane went right away to the office of her unit manager, Mrs. Smith, to talk over what she heard. Uh, Good morning, Mrs. Smith. Can I talk to you for a minute?
Good morning, Jane. Sure, come in. How can I help you? Is there anything you'd like to discuss?
Yes, Mrs. Smith. I came here to discuss my concern with patient Carl involving his wife and Dr. Warner. I was about to give my patient's morning medications when both of them were in the hallway near Carl's room. And I have overheard them discussing patient Carl's condition, and Mrs. Betty was begging to not disclose to Carl his own medical diagnosis and the treatment plan of care. And after that, they both agreed with the same consensus to not reveal and discuss to Mr. Carl his own condition. I was alarmed and worried because he will be denied the rights to control his personal health information involving the privacy and confidentiality of his own medical diagnosis. And if he's going to agree or disagree with the treatment plan of care.
Understand your concern, Jane. Please tell me more about this matter.
Yes, Miss Smith. Because I believe that as a nurse, I am obliged to clearly communicate to my patient the details of care or a service intended to provide him, which is part of the CNO's code of conduct. And if Dr. Warren is not disclosing confidential information about the treatment plan of care, there would be an ethical conflict related to maintaining commitments and truthfulness to the patient. And my main obligation as a nurse and my primary concern is always to the patient. And I must respect the need of my patient to include his own decision in every treatment plan of care. And any conflict of interest should be shared and explained to the patient, right?
Jane, you know what? I am glad that you brought up this information to me. It is important that you speak on behalf of your patient. Thank you for that. And let me check your patient's file and relevant information. And I will arrange a private meeting with the patient's wife and with Dr. Warner.
Based on the nurse and nurse manager's conversation, it illustrates that the nurse is experiencing an ethical conflict related to client well being, privacy and confidentiality, maintaining commitments, and truthfulness. The argument for this option is the priority to respect the patient's well being. According to the College of Nurses of Ontario, the nurse's main obligation and primary concern is always to the patient, and the nurse can only maintain professional boundaries and nurse-patient relationship by protecting the patient's privacy and confidentiality.
The same day, Mrs. Smith set an immediate private meeting with Dr. Warner and Mrs. Betty to discuss the issue.
Morning, everyone. Thank you for attending this session to discuss the issue of non-disclosure requests about the patient's final diagnosis. Just to let you know that Nurse Jane, who is the primary nurse of the patient, came to know about an important issue concerning her patient named Carl Williams with a medical record number of 3467890. He is currently in room 11 and located at the right wing of the department. Nurse Jane is well aware of her professional obligation to her patient. That is why I arranged this meeting with the people involved to discuss and settle the issue. Present in the session is the primary doctor of the patient, Dr. Warner, and Mrs. Betty, the patient's wife.
Good morning, Mrs. Smith. I'm Carl's wife, and I have been telling to Dr. Warner that my husband is too old and to know his condition. He suffered a lot in his past traumatic experiences. So I guess this is another painful experience for him knowing that he's having cancer.
His wife, Mrs. Betty. However, as nurses, we have moral and professional responsibility to your husband in accordance with the law. It is of great importance that the appropriate committee will assess your husband's capacity to make decisions, and then the rules and regulations must take into consideration.
My decision is final, that I wouldn't want my husband to know all about his terminal illness. And I have made up my mind. I'm the wife, and I have full right to take decision on the behalf of my patient or for my husband. And I know what's better for him and for our family.
I respect your decision, Mrs. Betty. And I'd like to hear now from the physician's point of view, Dr. Warner, on how you came up with your decision.
Hi, Ms. Smith. I'm just considering Mrs. Betty's wish not to disclose Mr. Carl's diagnosis. I'm his daughter, and I have the authority to make the treatment decision on behalf of the patient and the patient family.
Thank you, Dr. Warner. However, on behalf of the healthcare team, this matter needs further investigation.
Conference has ended, yet the issues are still unresolved. Mrs. Smith, the nurse manager, has decided and forced to escalate the issue to the ethical committees.
According to the College of Nurses of Ontario, the healthcare providers have no right or authority to make treatment decisions or decisions to consent to the admission on behalf of the patients, except in an emergency or crisis when no authorized person is able to make decisions. In this case, the consent to treatment and the capacity assessment in providing treatment includes promoting the client's right. Healthcare professionals have the responsibility to protect patients' confidentiality and privacy and to raise any potential concerns or considerations for the plan of care. Accordingly, the board members of the Ethics Committee would allow the appeal and remit the matter to the Consent and Capacity Board, following the practice guidelines about the Healthcare Consent Act and the Substitute Decisions Act 1992.
Healthcare team followed the practice guidelines of Healthcare Consent Act and Substitute Decision Maker Act. Upon assessment, the physician who is proposing the treatment plan of care found that Mr. Carl was still capable of making decisions and able to understand information such as the possible consequences of his own treatment of care. Therefore, the patient is still competent and able to consent for himself. Thus, the healthcare providers have an obligation to inform the patient about their medical care, including potential harm or adverse effects of any treatment before the patient's decision. As a healthcare professionals, utilizing an ethical decision-making process is essential to resolve any conflict involving any ethical principles. Seeking guidance or supervision from the higher authority, and with the use of proper self-reflection and value clarification process will help. Any unacceptable and unethical decision in any complex cases can lead to patient harm. Healthcare professionals are often legally obligated to take a particular course of action to resolve any issues. However, determining legal obligation and duties, considering options would be ethically sound and professional, considering the possible negative and positive outcomes of each option. And maintaining patients' privacy and confidentiality is important and would be helpful to address and prevent any ethical dilemmas. Lastly, nurses must know the code of ethics and recognize their own integrity and moral character within their professional responsibility. And these are the key learning points of this presentation.